see a phrenic nerve passes anterior to anterior scalene muscles, and you can see subclavian artery passes posterior to anterior scalene muscles. This is the middle scalene muscles, originate from transverse process of C2 to C7 and inserted to first rib posterior to scalene tubercle. And finally, this is the posterior scalene muscles, originate from transverse process of C4 to C6 and inserted to second ribs. All of scalene muscles, it has a different function. For example, elevation of the ribs, the first and second ribs, and it has when the scalene muscles contract, leading to flexion in the neck. Actually, it's an act for flexion, and it leads to flexion for the neck region. This is the posterior triangle divided by inferior belly of omohyoid muscles. Two different triangle, occipital triangle is here, and supraclavicular triangle is here. Another name of supraclavicular triangle is subclavian triangle, because this triangle contains subclavian artery and subclavian vein. Posterior triangle contains accessory nerve. It has oblique direction. The accessory nerve innervated the SCM muscles. After that, entered to posterior triangle and entered to trapezius muscles and innervated the trapezius muscles. In the posterior triangle, you can see a different branch of cutaneous cervical plexus, such as lesser occipital, greater auricular, transverse cervical, and supraclavicular nerve. And in the posterior triangle, there is a brachial plexus. There is a subclavian artery and different branch of subclavian artery. And there is external jugular vein in the posterior triangle. This is a summary of component of or connect posterior triangle component or content. Consists of external jugular vein, subclavian artery and vein, accessory nerve, cervical plexus, and brachial plexus. This is the posterior triangle and occipital and supraclavicular triangle. Please look at the anterior triangle. Anterior triangle, in the anterior triangle, there is a hyoid bone. So this triangle is divided to suprahyoid and infrahyoid parts. In the suprahyoid part, there are two triangles, submandibular triangle and submental. Submandibular and submental. But inferior to hyoid bone, there are two triangles, carotid triangle and muscular muscular triangle. I explain about the original insertion of neck muscles. After that, you should explain about the boundary of this triangle. Please listen to me carefully. This is a submandibular triangle or digastric triangle. This is the submental triangle. This is the carotid triangle and muscular triangle. At first, I explain about the infrahyoid muscles. This is the hyoid, this is the infrahyoid muscles, and these are suprahyoid muscles. Infrahyoid muscles consist of four muscles: sternohyoid muscles, omohyoid muscles, sternothyroid muscles, and thyrohyoid muscles. Omohyoid and sternohyoid muscles is located superficial, but the sternothyroid and thyrohyoid muscles are located deeper than sternothyroid and omohyoid muscles. All of infrahyoid muscles innervated by ansa cervical forms by C1, C2, and C3. But the thyrohyoid muscles, these muscles, innervated by C1. This is the sternohyoid muscles, originate from sternum and medial part of clavicle and inserted to hyoid bone. This is the omohyoid muscles, originate from suprascapular notch and inserted to hyoid bone. The omohyoid muscles consist of two belly, inferior belly and superior belly, and inferior and superior belly joined together and attached to clavicle by intermediate tendon. This is the intermediate tendon. The green muscles is a sternothyroid muscles, originate from sternum, clavicle, and first cartilage, and inserted to thyroid cartilage in the larynx. And the red muscles is a thyrohyoid muscles, originate from thyroid cartilage and inserted to hyoid bone. But the suprahyoid muscles consist of four muscles: mylohyoid muscles, digastric muscles, stylohyoid muscles. This is the stylohyoid. And deeper to mylohyoid, you can see geniohyoid muscles. This is the mylohyoid muscles, originate from mylohyoid line on the body of mandible and inserted to hyoid bone. At the midline, left and right mylohyoid muscles forms the median raphe. This is the digastric muscles, consist of two belly, anterior belly and posterior belly. Posterior belly of digastric originate from mastoid notch and finally terminate to intermediate tendon. Anterior belly of digastric originate from digastric fossa from mandible and inserted to intermediate tendon. Intermediate tendon finally inserted to hyoid bone. This is the geniohyoid muscles located deeper to mylohyoid muscles, originate from inferior mental spine and the mandible and inserted to hyoid bone. And the fourth muscle is the stylohyoid muscles. This one originate from a styloid process and inserted to hyoid bone. This is the stylohyoid muscles. This one. Stylohyoid muscles and posterior belly of digastric innervated by facial nerve. Mylohyoid muscles and geniohyoid muscles geniohyoid muscles innervated by C1, mylohyoid muscles and anterior belly of digastric innervated by mylohyoid nerve is a branch of trigeminal nerve. This is the omohyoid muscles, sternohyoid, sternothyroid, and thyrohyoid muscles. You can see ansa cervical. This is the ansa cervical, innervated infrahyoid muscles, except of thyrohyoid muscles, innervated by C1. This is the C1. And enter to thyrohyoid and geniohyoid muscles. There are 4 muscles in the prevertebral region, consist of rectus capitis anterior, rectus capitis lateral, and longus capitis and longus coeli muscles. This is the anterior rectus capitis anterior, originate from base of skull and occipital condyle and inserted to atlas bone or atlas vertebra. This is the rectus capitis lateralis, originate from jugular process from occipital bone and inserted to transverse process of atlas vertebra. And this is the longus capitis and longus coeli inserted to cervical and thoracic vertebra. The longus capitis has an upper part, middle part, and lower part. And this is the prevertebral muscles. Before you explain about the boundary of triangle, please look at this video. After that, I ask you about the boundary of triangle.
Now, we'll look at the muscles that by means of a mylohyoid muscle cavity. The mylohyoid
This is
muscle
the mylohyoid
arises
muscle.
from the mylohyoid line on the mandible. Most of its fibers pass downwards and medially, joining in the midline with the fibers from the opposite side, all the way from the symphysis of the mandible to the body of the hyoid bone. The more posterior fibers of the mylohyoid insert here on the body of the hyoid bone.
Insertion of mylohyoid muscles.
The mylohyoid muscle has a free posterior border, which runs straight downwards when seen from the side, also a little inward when seen from behind. Now we'll add the 2 geniohyoid muscles to the picture. Here they are.
Geniohyoid muscles.
They lie above the mylohyoid. On each side, the geniohyoid arises from the lower part of the mental spine, It inserts here on the body of the hyoid bone. Now we'll bring the base of the skull into the picture and add the muscle that pulls upwards and backwards, the stylohyoid.
This is the stylohyoid muscles.
It's a long, slender muscle. Just above its insertion, there's an opening in the stylohyoid. The digastric muscle passes through this opening, as we'll see. The
stylohyoid muscles at the lower part produce the opening or foramen, and you can see this foramen. From this opening, you can see a digastric muscle. Posterior belly of digastric passes between this opening and connected to anterior belly of digastric.
Gastric muscle passes through this opening, as we'll see. The stylohyoid arises from the lateral aspect of the
stylohyoid muscles.
It's inserted on the base
Insertion
of the
stylohyoid muscles.
Next, we'll add the digastric muscle to the picture. Here it is. The digastric muscle is unusual in that it has two bellies, an anterior and a posterior, that are connected in the middle by a tendon. The posterior belly of the digastric arises here from the digastric notch on the underside of the temporal bone and from the medial aspect of the mastoid process.
This is a mastoid
The
notch.
origins of the sternocleidomastoid and splenius muscles, which have been removed in this dissection, lie lateral to it. The posterior belly narrows to a tendon which passes between the two slips of the stylohyoid. The digastric tendon then passes through a sling of fibrous connective tissue by which it is tethered to the hyoid bone, here. The tendon then broadens out into the anterior belly of the digastric, which runs almost straight forward beneath the mylohyoid. It's attached low down on the inner aspect of the body of the mandible, just lateral.
This is the digastric fossa, is the origination of anterior belly of digastric muscles.
Lastly, we'll take a brief look at the attachments of the three muscles that pull the hyoid bone downwards. They're the omohyoid, sternohyoid, and thyrohyoid muscles, known collectively as the infrahyoid muscles. Here's the body of the hyoid bone. Here's the upper end of the omohyoid muscle, which goes all the way down to the scapula. Medial to it is the sternohyoid muscle, which goes to the sternum. Behind these two is the short thyrohyoid muscle, which goes down to a structure we haven't seen yet, the thyroid cartilage. These muscles insert on the edge of the body of the hyoid bone, the thyrohyoid here, the omohyoid here, and the sternohyoid here. You'll see these three muscles more fully later in this tape. The infrahyoid muscles pull the hyoid bone downwards. Acting together with the digastric muscle, the infrahyoid muscles assist in opening the jaw. The actions of the other hyoid muscles that we've seen are evident from the direction of their fibers.
Please look
Now
at
we'll add the
another
clavicles
video.
and the scapulae to the picture, and go round to the back again to look at three large muscles that shape the back of the neck: semispinalis, splenius, and trapezius. We'll add semispinalis to the picture first. Here's semispinalis, and on the occiput. In addition, it's a broad strap of muscle which arises from the spinous processes of T3 to C7, and from the lower half of the nuchal ligament. Splenius passes upward and laterally to insert in the
Spinous muscles forms the floor of posterior triangle, and you can see original insertion of this
lateral
muscle.
half of the superior nuchal line, and on the back of the mastoid process. Splenius assists in rotating the head toward the same side. This muscle beside splenius is levator scapulae, which is shown in volume 1 of this atlas. Lastly, we'll add trapezius to the picture. Here's trapezius. Trapezius is a large and complex muscle. As shown in volume 1, its lower part extends all the way down to T12. Here we're concerned only with its upper part. The upper part of trapezius arises from the medial part of the superior nuchal line and from the nuchal ligament. Its fibers fan out downward and laterally to insert on the spine of the scapula, the acromion, and the lateral third of the clavicle. The trapezius muscles largely define the shape and outline of the neck, both from behind, here are the two trapezius muscles, and from in front. This is trapezius again. Trapezius is thought of mainly as a shoulder muscle. Its upper part raises the scapula. In addition, when the scapula is held steady by the action of other muscles, trapezius acts in the same way as semispinalis would. Here it is, cladomastoid. The last muscle to add to our picture is the sternocleidomastoid. Here it is. It arises from here on the mastoid process and just behind it. The sternocleidomastoid muscle runs downwards, forwards, and medially to insert partly on the medial end of the clavicle and partly on the manubrium. Contraction of one sternocleidomastoid muscle produces rotation of the head toward the opposite side. Contraction of both sternocleidomastoids together produces flexion of the head and cervical spine. When we're leaning backwards, their tonic action prevents gravity from extending the head and neck. The tendons of insertion of the two sternocleidomastoid muscles, together with the medial ends of the clavicles, define this hollow in the lower part of the neck. Next, we'll go round to the front to see the longus muscles and the scalene muscles. Here are the longus muscles, longus cervicis here, merging with longus capitis higher up. Longus capitis arises from the base of the occiput and inserts on the transverse processes of C3, 4, and 5. Longus cervicis arises from the bodies of C1 to 4 and inserts on the bodies of the vertebrae from C5 all the way down to T4. Longus capitis and cervicis are weak flexors of the head and cervical spine. Next, we'll add the three scalene muscles to the picture. The anterior scalene, middle scalene, and posterior scalene. They arise from the transverse processes of the lower 5 cervical vertebrae. The anterior scalene from the anterior tubercles, the middle and posterior scalene from the posterior tubercles. The anterior and middle scalene muscles insert on the first rib. The posterior scalene inserts on the first and second ribs. The scalene muscles are involved not in movements of the neck, but in elevating the upper ribs in deep inspiration. The scalene muscles have important relationships to the subclavian artery and the brachial plexus, shown in volume 1 of this atlas.
So come back to boundary of triangle. Anterior triangle of the neck contain of submandibular, submental, carotid, and muscular triangle. Who is volunteer for explain of boundary of carotid triangle or muscular triangle or submandibular or submental triangle? It's very easy. Who is volunteer? Explain about boundary of carotid triangle. Please look at the carotid triangle and explain about the boundary of carotid triangle. Nobody? Carotid triangle terminate to posterior by SCM muscles, terminate to anterior superior by stylohyoid and posterior belly of digastric, and terminate anteriorly by anterior inferior by superior belly of omohyoid muscles. Muscular triangle encloses between superior belly of omohyoid, anterior border of SCM, and midline plane. Submandibular triangle or digastric triangle encloses between inferior border of mandible, stylohyoid muscles, posterior belly of digastric muscles, and anterior belly of digastric muscles. But the submental triangle, this is the submental triangle, encloses between anterior belly of digastric, hyoid bone, and midline plane, or some references explain about one submental triangle. And this triangle terminate or encloses between anterior belly of digastric and hyoid bone. This is the submental triangle. Lubna and Said Aifa, I think, yes, that's right. Thank you. I explain about the function of muscle. For example, infrahyoid muscles causes the move hyoid bone to inferior, and suprahyoid muscles causes the movement elevation for hyoid bone, and some muscles causes the mandible move to inferior. It has a different function and depend on which part of the muscles contract, or actually which head of the muscles contract. Do you have a question about the suprahyoid, infrahyoid, and division of triangle in the neck region? Okay, I sent 4 PowerPoint and 4 video files for Representative Ahmed, and I think I forgot the name of